This young man's family's looking for some support. He's banging his head against the couch, against the wall, biting his arm, hitting himself in the head. This is self-injurious behaviors. I want to offer some insight. I'm a speech therapist that's been working with autistic clients and kids for over 20 years and to guide you on some things to consider. I also want to note that self-injurious behaviors is not an autistic trait. And a lot of times I see professionals or other providers presuming that it's an autistic trait. And then what ends up happening is that they make an assumption that, oh, it's inevitable that this person is going to be banging their head against the wall. So let's try some of these strategies over here in my little strategy toolkit. And those just end up making things worse over time because we're never addressing the underlying cause. And whatever that underlying cause was, it tends to get worse. And then it tends to create other problems.
Hey special family, welcome back to another video. If you're new here, I'm AutismMom, and on this channel we talk about autism and everything in between. In today's fair use reaction video, we're going to see how to handle an autistic child scratching, hitting, biting, you know, when they get aggressive. One therapist is showing us in a video how she handles this situation. You might have one way of handling it, but she's showing a way that works for her. Take a look.
You know, when you keep running to me and trying to kick me and stuff, I just get so confused. I don't know what it means, Danny. I have no idea. If there's something you want, you can tell me with your words. You can use your eyes, you can use your gestures, you can point and show me. But I don't know what it means when you're rough with me like that. I ask that you be gentle with your friends, because they won't understand what that means. And it's not going to help you get what you want in your life. I appreciate when you're gentle. I love it when you're gentle. I love your eyes. I love your words. I love when you point. It's amazing and it helps you in your life. I see you listening to me. If you can just tell me what you want. Oh, you want to walk? What? You don't have to hit me. You just tell me walk. Walk. Walk, walk, walk.
And while we're at it, we're going to show some more therapists or parents that deal with this and some suggestions, tips and tricks that might help a parent out there who is in need because they don't know what else to do when the child is self-harming. These are some tips and tricks that therapists and parents are sharing. Take a look.
This young man's family's looking for some support. He's banging his head against the couch, against the wall, biting his arm, hitting himself in the head. This is self-injurious behaviors. I want to offer some insight. I'm a speech therapist that's been working with autistic clients and kids for over 20 years and to guide you on some things to consider. I also want to note that self-injurious behaviors is not an autistic trait. And a lot of times I see professionals or other providers presuming that it's an autistic trait. And then what ends up happening is that they make an assumption that, oh, it's inevitable that this person is going to be banging their head against the wall. So let's try some of these strategies over here in my little strategy toolkit. And those just end up making things worse over time because we're never addressing the underlying cause. And whatever that underlying cause was, it tends to get worse. And then it tends to create other problems. So here's what we do. We presume that there's an underlying cause that's leading to this self-injurious behavior. Step one, consider if there's a medical condition going on that's not visible to you, but they can feel it internally. Is there a migraine? Is there tooth decay? Is the throat hurt? Is there reflux? Is there a urinary tract infection? Is there gallstones? Is there constipation? A million things can be going on. Get blood panels done. And then step 2, how is this child or this young man able to communicate? Do they have a way to tell you where the pain is located? Next, consider the environment. Is the air conditioner on or the heater on? Is it making a loud sound, or is there somebody outside? During these moments, understand that this is not voluntarily happening. They're not doing it intentionally. So take a deep breath, allow them to get through the meltdown, remove any dangerous items that might be in the area, offer a pillow that can help between the hard surface and their head, and refrain from using a lot of language because that can really increase the frustration and the processing time. And then when they're back to being regulated, work on strategies to get to the underlying reason or the underlying cause. Seclusion rooms and restraint and planned ignoring and offering a replacement toy to hold instead of hitting their head, or any of those types of strategies aren't getting to the root of the why. And if you need a person that understands this, an occupational therapist, a speech therapist, to help guide you with the language, that's neurodiversity affirming. The head to neuroaffirm.com. Find somebody that's maybe a virtual therapist or someone in your area that can help guide you on these types of things. I hope that you found this helpful. Until next time, my friends, that is one to grow on.
All right, so a lot of people don't want to talk about it, but let's talk about autistic children and aggression. All right, a lot of times autistic kids will be labeled as bad kids or aggressive for no reason. But one of the biggest reasons why these kids aren't able to, control their behaviors is they struggle to express themselves, right? They might be nonverbal, or even if they can speak, they have a hard time expressing themselves. So the first thing that we want to do is we want to control the aggression in the immediate situation. Make sure everybody's safe, right? There's no harm to others, no harm to self. After that, we want to make sure that we can help this child express their needs. If they're nonverbal, we'll take pointing. If they can point somewhere, we'll take that. We'll take all the wins that we can get. And as we help this child express their needs better, a lot of times in my personal experience with patients, you see the aggression come down. And then once there's no aggression and they can express their needs, we do our best to integrate them into society.
Self-injury, property destruction, and physical aggression were occurring before therapy began. Protective equipment was already in place prior to my arrival, so my first step here was to move him from the hazardous setting to a designated safer area that has been positively associated with reinforcement in the past. During this phase, I use non-threatening body language by sitting at a safe distance, making sure I don't crowd his space, yet close enough to show that I'm available for him. I limit verbal redirection to prevent it from being perceived as a demand, which could escalate the situation. It's important to use a neutral tone of voice and avoid lengthy explanations during a crisis. 5 minutes go by with no severe behavior, so we attempt to transition back to his room. I continue to respect his space, remove protective equipment, and focus on creating conditions that might motivate him to engage with me. I observe social cues indicating he may be ready to interact. I then invite him to engage, but remain mindful that if I were to observe any signs of resistance, I'll be ready to take a step back and meet his needs. My goal here is to rebuild rapport and gradually return to skill-based treatment, ultimately turning a crisis into a learning opportunity.
Here's how we treat someone with aggression and autism. So I have a 10-year-old boy that I'm seeing who is in the therapeutic school right now, and he's getting a lot of behavior support like ABA therapy and like managing risk factors and making sure that he doesn't harm himself. Like they give him a helmet and there's staff with him, and he does a lot of self-biting, and sometimes he gets aggressive toward the other kids. And so his behaviors become a lot this hard to manage, right? Especially because you need that 24-hour staff. And so that's where medications come in. And so for him, we're using a medication called risperidone, which has been FDA approved to treat aggression, specifically in autism. And this kid has difficulty swallowing meds, so we have him on the liquid form. And so we started with 1 milligram, the liquid twice a day, and then moved up to 1.25 milligrams. And it just spoke with the family and the school administrator, and sounds like it's made a huge difference for him. Like he's biting now only like 1 or 2 times per week. He's not aggressive anymore towards the other kids or towards the staff. And I saw him in my visit as well, and he was like very pleasantly smiling and happy. So I've seen a lot of families who have kids with autism, and the kids are really struggling to express themselves and to like vent out their frustrations and things in a healthier way. And so that's why they either self-harm or attack others. So the medication is really helpful to help them regulate their behavior. And so far, he's had no side effects from it either. So this could be something to suggest to your doctor too.
Please let me know in the comment section below if you have any tips and tricks so we can help someone in need who doesn't know what to do in this situation or is out of resources. I'll catch you in the next video. Bye.